Hi everybody, Dr. Mary here again at Family First Chiropractic. I'm also the medical chair for Impacted Inc. And we've been talking about our poster. We're going to finish out this last section. So far we've talked about the physiological, then the vestibular. Today is going to be the cervicogenic piece, or the neck component. By far my favorite area to talk about for a couple of reasons. First, the neck is critical to the body as a whole. All of you already know this because if somebody has a high neck injury, you know that can be incompatible with life. If it's significant and it's lower in the neck, you know we can see paralysis. When we're talking about the injuries that we're talking about with regard to concussion, remember, not just brains can be concussed, but spinal cords can be concussed. Famously, Ryan Shazier had a spinal cord concussion just a few years ago, and it impacted his ability to walk. Typically, those are transient. People do get their function back, but it's taken him quite a long time. He's definitely not going to come back at the level that he was previously, and he's not stable enough to go back to being a football player. So these can be very significant injuries. The neck especially, because of the reasons we just said, it's so important to the body as a whole, and really important nerve roots are exiting through that area. So when we talk about a cervicogenic injury or a cervicogenic component of a concussion, then we're talking about eyes being affected, we're talking about neck pain, we're talking about decreased range of motion and stiffness, but we're also talking about, most commonly in the top of the list for most concussion patients, really bad headaches. And oftentimes they'll be diagnosed and somebody will say, oh, you have migraines now, or you have tension headaches or episodic headaches. These are cervicogenic. In fact, 80% of all headaches are cervicogenic, meaning caused by the neck. When there's changes in that neck, then the firing rate of the musculature in that neck is also changed. And this has a tremendous impact both on blood flow and tension in the muscles. So if you're a person that's been through this, and it's been maybe years since that concussion, but you're left with headaches, then you fall into that category of post-concussion syndrome, and headaches are your symptom at this time. Those can still be corrected. If you've just had a concussion, then those headaches also need to be looked at by someone that can evaluate that neck, that cervical spine area, because it requires very specific rehab strategies. So make sure you're working with somebody who's capable of walking you through that treatment protocol. We at Impacted Inc. Are a resource for you. If you have questions, please contact us. If you want this information in your facility or for your group or for your team, let us know. We're here to come to bring this information to you, and we will come out to your facility to do that. I hope this helps. And for now, that'll be pretty much the majority of what we needed to cover for our poster, but we will be bringing you more information. In fact, a number of us that are a part of this awesome organization will continue to bring you insight and understanding. But like I said, if you have any questions, please contact us at Impacted Inc. and have a great day.